Now, when we look at, obviously, a community program, the first question you're going to ask is, well, how well is it attended? Do people drop out? And a lot of you will know how difficult it is, A, to recruit for these types of programs, but B, also to get families to continue coming to a program that's 10 weeks long, twice a week, so 20 sessions over 10 weeks. And you can see here, across all 3 studies, we've managed to achieve around an 80% attendance rate. And we have just around sort of a 10% dropout rate. So about 1 in 10 kids drops out, but on average, we have about an 80% attendance rate. And what we also see is that 90% of children actually reduce their BMI after the 10-week program. I just thought I'd share with you a case study, which I find quite interesting. And this was an evaluation that was performed by Department of Health West Midlands. They have child obesity rates well above the national average, and so they commissioned Worcester University to evaluate 7 different child weight management programs already happening in the Strategic Health Authority. And in terms of the MEND results, it was a 2-year evaluation. There were 48 programs ran over those 2 years. We had 488 referrals to the program, of which 86% were recruited to the program. So often families are referred but then don't engage for whatever reasons. So over 80% were actually recruited. All families were living in the most deprived areas of the West Midlands. Very similar results. 90% of them either maintained or lost their BMI. And at 6 months, the results were either improved or sustained. What's also really interesting is if you look across here, these were the 7 programs. I mean, the only 3 really available nationally are kind of Watch It, MEND, and Carnegie. You can see that costs varied for the programs anywhere from sort of 200 all the way up to £600 per participant. And just so this was total cost of running the program. But when you actually look at the changes in BMI and waist circumference, you can see a huge amount of variation. Some of the programs actually caused an increase in BMI, which is obviously worrying. And others had very little effect in terms of reducing the BMI. Men produced an almost 1 BMI unit reduction, by far the greatest reduction. In terms of waist circumference, again, I think it was 1 program increased waist circumference by almost an inch, 2 centimeters. There was no change for that one for BMI. But in terms of overall waist circumference reduction, men, again, didn't have the greatest reduction compared to that one. But that was quite strange, considering BMI didn't change, but waist dropped. So I think there's something strange going on there. But also interesting was the only one that had an improvement in self-esteem. And what they concluded is that MEND and Watch It were the only 2 programs with peer-reviewed evidence. And in summary, they said evaluations of the MEND program have used rigorous methodological design, and the findings suggest that the program produces significant improvements in a range of outcomes, including waist, cardiovascular fitness, and self-esteem. MEND appears to offer good value for money in terms of benefits to weight status, psychosocial functioning, and behavior change. Cost effectiveness is obviously key. So what we've done is we've worked with York Health Economics and the New Economics Foundation to actually put a cost on the health outcomes and the well-being, so the social outcomes of the program. And so for a cost of between £400 to £700 per family total cost to go on a MEND program, you achieve £4,000 to £5,500 of combined health and psychosocial value. In terms of the ISA, which some of you will be familiar with, NICE recommends interventions that have an ISA between £20,000 to £30,000. MEND ISA is £1,700. And just to put that into perspective, the ISA for gastric banding is just over £10,000. So a very cost-effective way to improve health and psychosocial well-being. Now, one of the things we have to do as well is there's such an enormous problem. One really has to think about, well, how are you going to scale these interventions? And just to show you briefly how we've managed to do that is we believe in working in partnership. Everyone has a role to play. Every organization has a role to play in all sectors. So we work with research partners, funding partners, and delivery partners to deliver our programs. And what we do is we train non-obesity specialists. Unfortunately, there aren't enough obesity specialists, there aren't enough dietitians, there aren't enough psychologists to actually see all of these obese children either in sort of individual consultations or even in groups. And the other problem is that they're really expensive. So when looking at the cost effectiveness, you need to look at using other professionals to deliver these kind of programs. We obviously support them with all their resources and kits, everything that the children need. We have a central sort of support team, and what this really allows us to do is to share experiences from one site to another. Some of our regional managers work with up to 50 different programs running around the country, but when one program kind of faces a problem and then solves it, all of that knowledge can then be shared with other programs going through similar experiences. Quality assurance is really important. We're obviously working with children. We need to make sure that the fidelity of the program is maintained, and that the programs, the leaders and the delivery is effective. And so we're going through ISO 9001 at the moment. And we really use social media to really harness all of these kind of personal experiences to not only promote the program using the media, but also to raise awareness. And I think awareness has been raised through the Change for Life program. And it's amazing to go onto kind of men's fan Facebook page and just see all of the stories from parents and some children. I know they're not supposed to be on there, but there are kids on Facebook, let's face it, writing, you know, the stories about their life and their experiences and offering to kind of support and help each other. So that's really interesting, and any of you can join that Facebook page or join us on Twitter and listen to all these things. If you type MEND in YouTube, you get loads of movies that have been filmed locally by local MEND programs as well. We also use the web to really help people to project manage their projects, but also to collect the data locally, but analyze it centrally. So everyone inputs the measurements locally, and we get that data, and we can do the analysis and produce reports for the families as well as the practitioners. A lot of community-based people, you know, realize that evaluation is important, but don't necessarily enjoy spending their time in front of the computer on Excel working out statistics, so we do that for them. After the program ends, we don't just dump the families and say, you know, it's your life, enjoy. We actually continue to support them centrally through a graduate website called MEND World, and you can have a look at that, mendworld.org. Although you do need a username and password to look into that, although you can just take a virtual tour of that website if you're interested. But we also work with local partners to continue providing things like weekly exercise sessions and to signpost the families to all the good stuff that's already happening out there within local communities. Our programs are very much localized for wherever they're delivered, based on the culture and the language, looking at things like the policy and the environment, the delivery partners, obviously having the research partners involved, and importantly having the funding. To date, no family has ever paid to go on one of our programs. So what it does mean is we obviously have to work hard to raise funding in order to enable the programs to be delivered free to families. I think those are limes, so they are supposed to be ripe. And this is really important for us, the fact that whatever we do is significant, measurable, and can be sustained. And the way we do this is really by inspiring children, families, and adults to lead and sustain fitter, healthier, and happier lives, with a real focus on changing the behaviors that cause obesity. So not focusing on the obesity, which is almost like the end point, if you like, but looking at the behaviors that have actually lead to obesity. And, you know, NICE and SIGN both recommend multi-component interventions like MEND as first-line treatment for child obesity. So we're really advocating to make sure that all children in the UK who are over obese have access to a child weight management program that has some data showing that it is effective and is obviously evidence-based. And the way we're going to do this is by building strong local and national cross-sector partnerships. So working with the private, the public, the academic, the voluntary sector. And this just gives you a flavor of some of our partners, sort of governmental and public sector on the left, all the way to private sector, and then kind of academic on the right. But at the same time, acknowledging the fact that we work with a whole range of primary care trusts, local authorities, and leisure providers who actually physically deliver the programs in their local communities. Thank you very much.